create 800,000 more abortions? That's a really good question. Well, let's now talk to Representative Diane DeGette. She's a Democrat from Colorado. Congresswoman, if taking this money away actually might create more abortions, what are they pushing for here? Is this a matter of semantics, or do they just fundamentally ideologically do contraception either?
This extreme agenda really says we don't want contraception or abortion, and we certainly don't want federal funding for those things. And as you pointed out, the Title X money isn't for abortion at all. No federal funding can be used for abortion. It's for pregnancy prevention and birth control. But as you also said, it's for women checkups. It's for pap smears and breast cancer screening. It's for treatment for all kinds of cancers. In some states like Montana, the only clinic for hundreds of miles is a Planned Parenthood clinic, and women go there for their wellness checkups. So, especially in this economy, when we're trying to create jobs and we have so much joblessness, for many women who have lost their jobs or lost their insurance, the only way they can go and get a checkup and a pap smear is to go to a clinic that has Title X funding. So to cut that is not only an extreme ideological agenda that has no place in a short-term budget resolution, it's also mean-spirited to women. And frankly, I think it's part of a concerted attack that we've seen since the first of the year on women's health, time after time after time.
Right, and actually, it's part of a larger pattern. This year, you know that Republicans have introduced bills in 30 states to limit abortion or restrict access. Some 362 bills in total. Look, when you see all of that, isn't it obvious that it's part of a larger fight against women's health and a women's right to choose overall?
The first vote that we had in Congress this year was a vote to reverse the health care bill. And the health care bill had a number of provisions for women's health, for pregnancy prevention and birth control and screening. It also said you can't discriminate against women in insurance policies because of their gender. To eliminate that, and I haven't seen any attempts to bring that back. So it's an all-out assault on women's health, not just reproductive rights, but also health care in general. And as you pointed out, it's a tiny little minuscule part of the budget, but yet the Republicans seem to be willing to shut down the government over these very extreme writers. I was standing here listening to Senator Brown, and I had a thought. If it's really not about these extreme Title X writers and these other social writers, why doesn't Speaker Boehner just come out and say, okay, we're abandoning our desire to have these writers. Let's talk about what we should really talk about, which is coming to some kind of agreement so that we don't shut down the government. He in all of these statements, he never says, okay, we will abandon this right-wing social agenda and let's talk about the budget, which is frankly what we should be doing.
Well, that would require him to be honest, and it's the same guy who's pushing this agenda, even though he knows for a fact it has nothing to do with abortion funding, even though he says the exact opposite. But we've seen this movie before. Representative DeGette, thank you for joining us. We really appreciate it. I know you've been a champion in fighting for this.
Thank you.
Never mind. All right, now the GOP claims that they have a mandate. They always claim they have a mandate.